All right, we'll go ahead and get started. It's 5:30, and we do have quorum. Exciting. Commissioner. We're missing, I know the judge is out of town and Dr. Smith is out of town, but everyone else seems to be here. This is great. So it's our May 10th meeting. For those who would like to speak at public forum, there is a form up there right at the table, right in front of the podium. If you would like to print that, fill that out, and you can hand it to one of the ladies up front. And before we begin, we would like to recognize a very special person. This person has spent countless hours behind the scenes making sure the trust is where we are today. She has poured over our financials. She has met with CSC's executive directors on the state. She's managed 10 people's schedules to try to set meetings. And she has provided all this to the trust for free because she loves the children of Escambia County and wants to see the trust succeed for them. And she and her family have even offered free space for us to meet and the use of employees for free. So without Miss Carolyn Appleyard and the Appleyard Agency, the trust would be not where we are today. And so we're so thankful that we've gotten to work with her. We've all become friends with her, and we are going to miss her. And so we have a plaque of appreciation for her and some flowers. And would anyone else like to say anything?
I would say it was such a cumbersome process to get started. We all got appointed, and it's like, what do you do next? And if we didn't have Carolyn keeping us organized, setting the meetings, everything that she did, I don't know how, without that help, we could have managed. We would have managed, but we would not be where we are today. So, Carolyn, thank you very much. We appreciate you.
I love doing it. Getting to know all of you all and what's going on and what the future looks like is so exciting. Great start with staffing, and can't wait to see what happens.
All right, thank you.
Madam Chair, I'd like to say that so grateful to the Appleyard family, the Appleyard Foundation. I served many years working in the community center with Eleanor Appleyard, and my father and John Appleyard were friends. And the work that you and Dickie and your family have contributed to this community is not measurable. And so for you to do it for free, I remember in the beginning, I would talk to Dickie and say we would fire her, but
Exactly. And you get what you pay for.
You get what you pay for. But anyway, thank you so much. We would not be here without you. And
I'm really glad it worked this far. So let's keep it going.
don't stay here. Get to a basketball game or a sports banquet.
We're still doing that ESP thing.
Oh, God, you're still watching us. Well, at least make Dickie leave.
Miss Carolyn, I know Rex wanted to say something, but I wanted to say something as well. Please. Oh, thank you. I just wanted to say thank you so much again. When I first moved back to Pensacola, our paths crossed, and I had no idea they would cross again. So I love your family. I appreciate all you do, and I, say what everybody else says. We definitely wouldn't be where we are. Even you, like, texting us and making sure we are on point and being deadlines, like, we definitely needed you, and the children of Escambia County appreciate you.
Thank you. We've all learned a lot.
Yes.
Right, Meredith?
Well, Carolyn, just want to echo everybody and Nikki in the back and all of you all that have contributed to where we are today, and realizing that what goes along with the flowers and the plaque is a continuation of your service on retainers, and we've all met and agreed that we're going to double what we've paid you for your service so far. Thank you.
Carolyn, everybody's talking, and you and I have been together a long time, and I love the fact that your family's here. Hi, Kate. Truly, as everyone said, we could not be where we are if you had not stepped up and taken all of the wonderful organizational skills you have and the money skills that you have and the connections that you have. So I really appreciate you, and I know you'll continue to do wonderful things for the people of our community.
Great group, great town, nice small town.
And Carolyn, I think I'm the only one here that did not know you but I know you now.
I've heard of you for a long time. I'm really glad that you know.
And so, like everyone else has said, we would not be where we are had it not been for Carolyn.
Thank you so much.
And don't go far, because in budget cuts, we may need some free services.
We're good. Thank you.
Thank you for coming, and thank y'all, Kate, Diane, and Nikki, for coming. All right, so at this time, we're going to move to the adoption of the agenda. I have a few additions and corrections to the agenda, so just bear with me. I would like to add a Personnel Committee report after the Treasurer report. Personnel has met twice since our last board meeting, and so I would like our Personnel Chair, David Peden, to just report on what we've been doing. I would also like to move up the Executive Director report after the Personnel Committee report. Some of the things we're going to be voting on, I think that we need to hear what she has to say before we vote on it. So, and I'm also going to take off one of the action items for approval, the additional days off, that needs to be taken off the agenda. So is there a motion to adopt the agenda as changed?
I move to adopt the agenda as amended.
Any discussion? All right, all in favor?
Aye.
Any opposed? Okay, so the minutes need to be approved from the April 15th board meeting, and they were previously sent out. Is there a motion to approve the minutes?
So move.
Second.
Any discussion? All right, all in favor?
Aye.
All right, that passes. All right, now the treasurer report. As you can see, our treasurer, Dr. Smith, is not here. However, the report was included in in the packet that was sent out last week. So is there any questions on that, as of March 31st, 2021, any questions on the financial report? Okay, is there a motion to approve those?
So move.
A second?
Second.
All in favor? All right. That passes. And Mr. Peden?
All right, thank you, Madam Chair. So over the last month or so, we've been advertising for a program director and also a finance director. The finance director is a key point that we need someone with governmental accounting experience. And what we found is there's not a lot of people who applied that has that experience. It's a very technical in nature. If you're an accountant but you have not worked in governmental accounting, it's apple and oranges from what I understand. So our director has advertised that position once at a starting salary of $80,000, and we did not have any candidates. We met again as a personnel committee. Also with the program director, the same scenario of qualified candidates. So we met last week as a personnel committee about for an hour, trying to find out the best way to go forward. Our concern as a new board and using taxpayer dollars, that we want to be accountable to the citizens of Escambia County who are paying for this trust. In doing that, we talked a lot about the optics of salaries and what to pay people. And on one hand, we understand that it's the optics of bringing in professionals at a higher salary may not look good to some. But on the other hand, if we don't have qualified people who know what they're doing, that's managing millions of dollars, it's going to be egg on our face for not having the right people that are qualified doing this job. So we, and also in this job market, the employees are in charge. Any employer, they are paying people to move companies, giving them bonuses, signing bonuses. It's just the world we live in right now. And so after speaking with Tammy, we re-advertised after last week the position for the finance director and the program director, and I think she had 60 applicants that were for the finance part, and none of them, maybe I think one had governmental experience, but they live, I can't recall what, New York. So we're even trying to think remotely about that. So today we met with the Personnel Committee met before this meeting again to talk about this, and the committee decided to give Tammy the ability to advertise the finance position from $85,000 to $100,000 range, and that's, and then the program director from the $85,000 to $90,000 range, and to see what she can come up with, any applicants with that. That being said, the program director piece, I want Tammy to touch on and what she has combined, because when we started this out with our budgetary process, we had planned to hire multiple positions, and also with our RFP we sent out to compile data. But Tammy believes that we can do that with one candidate, one employee job description, and save costs that way. If you want to, Tammy, talk about that.
Thank you. Yes, I'd contacted some of the other children's services councils and asked them for more information about how they have structured their director of programs position or the equivalent. And several of them had combined that position with the head of research, particularly in the smaller CSCs like St. Lucie County, which is comparable in size to Escambia County. And that seemed like a good model. So I took a couple of other job descriptions. Ours borrows heavily from the Children's Services Council of Martin County in particular, and pulls in some of the research components. By doing that, it sort of combines the research manager position that we had in the original staffing plan and pulls some of the higher level responsibilities into that director position, so that it's director of programs and performance, so that you link those two. And that person then will have a lot more to do with the strategic planning and with the needs assessments that have to be done periodically every couple of years. So it's not a once and done type of exercise, and then could also build in all of the metrics into our RFP processes as we go forward. So it just made more sense to combine those. So we're really pulling from that salary because we can hire a lower level, if you will, position for what we originally had slated as a research manager. So with those savings, this will actually be budget neutral to adjust the two salaries for the director positions. And that's just because of the market. Because as I pointed out to the Personnel Committee, our neighbors in Leon County are having the same issue that we are, and they have increased their salary range as well to start at 95. And I believe they have a smaller budget than we do even, but that's just what the market will bear right now, so.
So with that being said, the Personnel Committee made those two recommendations for those ranges, one for the finance from 90,000 to 100 range, and the program director from the 85 to 90,000 range. And if anybody has any comments or questions or suggestions, we can talk about it.
I would, Madam Chair. Director Pete, and that's fine, whatever the majority does. But I certainly want to acknowledge that there was opposition, that this was a job creation for high salaries for a few. And the intent is always to accumulate as much money for direct services. And so if that is the salary, the average salary in my district is $27,000. The average salary in Escambia County is $55,000. And probably the average salary of the people that we're helping is probably about $17,500. And so if it takes us to get qualified people, then that's fine. I can just tell you that Tax Watch, Citizen Watch, all those people are watching. For a nonprofit with a budget of $10 million, you have to look at your administrative salaries. We have a $600 million budget. And, we brought in, our finance director was at 90,000, and we just raised them to 120, and no one in those offices make that amount of money. I'm good with it, but I want to acknowledge it and certainly put on record, that we're not trying, unfortunately, I don't believe that people should be in public service, to make a whole lot of money. It's about how you give. I can be supportive of it, but we certainly got to be very aware that we're going to grow, I mean, you're not going to limit your staff to just 5 people. I mean, no matter how you say it. So that's one issue that we have to deal with. And then the other issue is, as we engage into employees, it's easier to hire than to fire. And if we hit a recession or if ad valorem taxes begin to decrease, we're still going to be faced with paying those salaries. And so I just, hope that as you look at that and as our staff look at it, that we recognize, it's great in the harvest season, but when it's not harvest, I mean, what do? You don't let them go. And so, and it's not just the salary that we're giving, it's the benefits. And so if we give someone $100,000, I mean, certainly I just want to put on the record, what is the package worth? I mean, with benefits, insurance, taxes, payroll, that salary becomes not $100,000, it probably becomes $150,000. And so I just hope we have that discussion and see the impact on the budget.
We did have, I totally agree with everything you're saying, and I think that's why we've been wrestling with this for so long, is that we had that, our meeting, we had it for 45 minutes earlier. But, talking to Tammy, she's advertised it at these salaries and she has no one qualified. Another nonprofit in this area, their finance director is $102,000 for a budget similar to ours. Tallahassee's at $95,000 for their finance director, for their CSC. St. Lucie, I think you said, or St. Mark, it was a 6-figure finance director position. So, I would love to pay less because it is taxpayer money, but the question is how do we get qualified people who can do this by paying less? And we've tried, and we haven't. So I'm all for saving as much money and giving as much money to our programs as we can, but we have to have people who know what they're doing and are qualified to work here. So that's kind of where it kind of gets tricky. So,
Madam Chair,
yes, ma'am.
I would also say that businesses are super struggling for employees. I know the county is struggling for employees. The Department of Children and Families is struggling for employees. We just had a job fair and we have like over 50 vacant positions, and out of that we netted 6 and only about 25 people showed up even to the job fair. So it's very difficult to find people to hire. And if we want quality work, we need to have that quality candidates.
Madam Chair, and of course, I'm not trying to put words in the commissioner's mouth, but what I heard him say was, it's important that we are not tone deaf to this or to any other issue. And the way to show that we're not tone deaf to it is to have this kind of conversation that shows that it's not a decision that's being made haphazardly, but cautiously and very meticulously because of the nature. We have to always remember the people that we're here to serve and the reason why we have this in the first place. At the same time, we were wrestling with how do you serve them with competent personnel. So I think it's worthwhile to prove that we're not a tone-deaf group of people here just, out here willy-nilly, if I can use that phrase. But at the same time, to have a genuine sense of caring that we do it the right way.
Thank you, Pastor. And Madam Chairman, listen, I'm not opposing it, and I hear exactly what you're saying. Exactly what I want to put on record is clearly this. When nonprofits come forth to ask for our money, and their executive director makes this, we go, oh, wow, you're paying that much money in staff? We're not giving you any money. It's called reciprocity. And so I'm going to put that on record. We do what we do. We increase the salary. I mean, there's a high demand for employees. I mean, there's a low supply. We all get that. I work at the county. I mean, we are in the nonprofit world, and at the end of the day, we are dealing with taxpayer dollars. But when we have our not-for-profits that will come forth with executive directors who make in the 6 figures, and we say, well, we're not going to fund them. I mean, you got 50% of your money going into your executive director salaries. We have to recognize that we're going to have nonprofits, they're going to have people that are going to make good money. And so I don't want to ever come to the point that we do this every day in our outside agency funding, where we don't fund because we got community health people who make $250,000. I have no problem. Prosperity in America is what we all hope for. because the children that we're dealing with are poor. But at the end of the day, we have to recognize that if we're going to pay top dollars and say we want it for performance, when our not-for-profits come and they're paying their executive directors and their staffs top dollars, even if they're mom and pops paying top dollar, we have to apply the same principle that they're hiring the best people. And that's all I would expect out of this board. And, you know, I'd be supportive, but I hope that we will have a memory that recognizes that point. And so many times when we distribute the funds to not-for-profits, we think they should volunteer and they should not be paid equitably. And we don't want to fund them because they're not putting all their money into direct services. And so that's the point.
Another question I have, Tammy, is I think that I heard you all say between you and David that regardless of the salary, there was some difficulty in finding people with credentials to meet our need. And one of the questions I have in addition to the salaries that we're proposing now is that I heard part of the way of keeping this cost neutral is we're putting yet additional responsibilities and things onto this person. And so I'm wondering if our pool of respondents is just shrunken because we're asking more of the people. Yes, we're paying more, but now we've asked even more of that position. And are we going to be right back where we are because we're trying to maintain this cost neutrality and things? So I'm just raising that question that are we kind of robbing Peter to pay Paul, and we're going to end up not paying anybody or getting anybody because we've now increased our expectations of what that position entails. And so now we've got to raise money more because now we're wanting more.
We talked about a variety of things, but if we hire two people at $60,000, it's still, you know, more than the one person or we're trying to get. I don't think so. I think it's a competitive salary for a professional job that demands a lot, and that's what you're hiring, and hopefully we can find the right fit. It is, I mean, we've spent a lot of time trying to get through this and make the right decisions, and we've debated a lot of different scenarios, and this is the best one for us right now that we came up with. So,
Well, I was impressed at looking at the notes of yours and others kind of out of the box thinking of adopting some of the time off similar to the school system of the 2 weeks at Christmas, a week for spring break, and some of these other remote participation in things as well that could go towards attracting people and maybe making the job a little more attractive as we go through this current job market that is so tight for whatever reason. I'm wondering where people are when I go to everywhere from McDonald's to things like this, and where did all these people go? So it's a tough position.
So, Madam Chair, to move forward, if it's the pleasure of the board, we'd like to move forward those recommendations.
I don't think do we need a motion for that, Meredith, and a vote? We said we didn't. So it was just a report from the Personnel Committee. So,
I thought you wanted the motion, but it comes as a recommendation.
well, it comes as okay, no, we needed it though, but she said, do we need it? She said.
The board previously delegated the responsibility of hiring to the Personnel Committee. You wouldn't necessarily need an additional motion to approve the action of the Personnel Committee. That's within their already delegated authority.
Yeah. I just wanted a report from the Personnel Committee just to make sure the board knew what was going on, because a lot of people weren't at the Personnel Committee. So.
And so it's going to be on the ground for how long? We're re-advertising for how long?
For a week.
Okay.
Do you want longer?
No, I mean, I don't, yeah, no.
I mean, she advertised it for a week last time, and she got over 60 responses, so,
All right.
I mean, that's pretty good.
So we got over 60 responses, but I mean, none of them would accept the job because of the salary.
They were not qualified, and I'll let you speak to that.
There were 4 who were qualified. We interviewed 3, and of the 3 that we interviewed, they're all currently making upwards of $100,000. And that was with it advertised at $80,000. And that's here in Pensacola. And when we re-advertised it after the Personnel Committee met last week, I got an additional 40-plus applicants, and of those, one is qualified, and I had advertised it as a possible remote position to cast a wider net. And the only person who had any nonprofit or governmental accounting experience, because the two are somewhat similar, it's fund accounting. The only one who was qualified is in the state of New York, and I have no doubt that that person would also command a higher salary, because I can't imagine living in New York City for $80,000 a year. So, so we have absolutely tried to cast as wide a net as we can, and that's with, you know, the benefits and everything. It's just a crazy market. I've never seen anything like it.
That's a pretty good response.
Okay.
100 people applied. So what's the total package, Dave? Benefits included?
We're still, as a personnel committee, working through the different scenarios, because we can't get numbers until we have, like, if we're with a employment agency or a personnel committee, you gotta have so many employees. We don't have all the details of our total package that we're working through right now. That's another issue that we're trying to, go ahead, Tammy.
I'm still waiting for the short-term and long-term disability insurance cost. And so I've got a decent cost on the health insurance, but they have to have all of the employees. You have to send them a census of your employees, and you have to have at least 2. So now that we have Avion, we had 2. And I sent that in, and so they sent me some numbers. But once I get all those numbers and I have the full package together, then I will need to bring it back to the board, because I'll need you all to vote on what percentage the trust will cover versus the employee will cover, for not only the employee, but also if we want to extend any coverage to dependents or spouses. So it's a little more complex, but it's certainly going to fall under the 25% that, you know, we had kind of set as a budgetary cap. So we may realize, depending on the health of the individuals that we hire, or whether they elect to take the coverage or not, that's going to impact how much we spend as an agency on the insurance package.
So Tammy, I mean, worst case scenario, it would be budget neutral. It wouldn't be adverse to our budget.
It will not be more than our budget, because you all will control that by determining what percentage of the total package you want to fund. So if the insurance comes in, let's say it came in really expensive, then you would only agree to pay, you know, the trust would only pay up to a certain amount that would not exceed the 25% of our salary line item that you already have budgeted.
Okay, great.
All right, any more questions? All right, thank you, Mr. Peden. At this time, we're going to let Ms. Greer do her executive director's report. And if it's in the packet as well, so you can look at the packet. Just jump.
So I'll try to make this short and sweet. We've spent a lot of time over the last month since we last met. We welcomed Avion, who I am pleased to say is officially on board, and it's been trial by fire. She came in, started redoing the website, which we hope to move over from the current platform to a new platform as soon as we get our IT services provider settled. She's doing a terrific job. She got a newsletter out. She made new name tags for all of you all. So lots of different things. She's got incredible skills. She's even helped me with some of the HR stuff so far. Speaking of HR, we set up our payroll process with ADP. We have Positive Pay in place now, which is a fraud prevention system that we have going with the bank. So that's live. And we've been working on getting all of the insurances and getting the prices, which I was just talking about. I've continued to meet with community agencies and have attended some special events for different agencies, which was wonderful. It's nice to get out and meet folks in the community. Things sure have changed a lot in 25 years since I've been here, and then some things haven't changed at all. We interviewed, as I said previously, we interviewed 3 candidates for the Director of Finance position. You've already heard about all of that. We met with Kleinhaus Consulting Group regarding the needs assessment plan and moving the timeline, which you all have a copy of the revised proposal. I sent that with the board packet. We also developed the first draft of the FY 22-23 budget. That needs to be finalized by July. We'll have a more definitive budget once we get our estimate of revenue from the tax collector, which should happen within the next month. And we developed our first draft of an RFP for a kindergarten bridge program, which I'm thrilled that we have an RFP draft. I will admit that it is not my finest work, but we got it done. And I vetted it by some folks in the early learning community, including 2 folks at the school district who are familiar with what kindergartners need to be prepared, who are familiar with the transition program that the school district runs. And also, I asked Bruce Watson from the Early Learning Coalition if he would take a look at it and give feedback. So we've gotten several people's input on it. So you got the revised version. The only thing that's left in there, unless the board has comments of things that you would like added or edited, I need to get a location for the RFP workshop. You'll see in the draft that is to be determined. I didn't want to reserve a space until we knew whether or not the board wanted to go ahead with this. I do recognize that it is a super fast turnaround that we're asking the community to entertain, but in looking at all of the numbers and what's going on with kindergarten readiness, and having talked to some of my colleagues about some of the best practices, a bridge program sounds like a good idea. So if there are providers out there who think they are ready to do this and can pull it off, I would love to see their proposals. I can pull together a grants committee, so I'll be sending an invitation to you all to participate in the grants committee. I'd also like to pull some content experts in who are not applying for funding so that they can speak to the quality of the programs that are being proposed. I intentionally did not put a floor or a ceiling on the amounts because I'm not sure how much it would cost for a program to get something up and running this quickly, particularly not in this job market, as we're all aware. And I did put that we would give extra points, and this was part of one of the suggestions that I got from the field, that we give maximum points if they involve a kindergarten teacher in the proposal plan, in the design for their project. So I'm sure you all have already had time to read through that, so that's on the agenda, but I did want to at least put it on the report in case you have any questions about it or any additional comments. The other thing that is an action item on the agenda, many of our sister programs do public education campaigns. We don't provide direct services as a Children's Services Council or a Children's Trust, but we can do massive public education campaigns. So there are 2 things that have kind of risen to the top in terms of needs. The importance of pre-K and early learning. Something that has come through loud and clear is that we just don't have all of the children participating in any kind of formal early learning program. They come into kindergarten and they're not ready, just like it says in the RFP, they're not ready for kindergarten, not only because they don't know shapes and letters and numbers and things like that, but they sometimes don't know their full name. They don't know how to line up. They don't know how to self-regulate their emotions. They don't know how to sit in circles. They don't know what a circle is. So there's really a huge need in Escambia County for parents to understand the importance of early learning and early literacy. So what the action item is for the board to let me know if you support the idea of developing an invitation to bid for a public education campaign around this topic. The other topic for consideration is water safety. This is, of course, huge in Florida with us being a peninsula and having water everywhere. A child can drown in as little as 2 inches of water. It may not be as big of an issue in Escambia County as in some of the communities in South Florida where there are canals and standing water everywhere. But because it is such an issue in the state, there's now legislation, and, Ms. Hightower can probably speak to this better than I can, because the school district has now been tasked with giving information to parents when they enroll their child into a public school, to give them information about water safety. And I don't really know how much information is even out there in Escambia County. So perhaps we could do something around water safety just to get the information ready and available as a resource for all of these parents so that we can prevent child drownings. So those are the two items that you'll see on the agenda for action. And then the next steps, the things that I plan to work on in the next month, in addition to hiring and onboarding a director of finance and operations, I hope, and a director for programs and performance, I hope, is we need to continue to work on the 22-23 budget process and the trim process, continue working on the needs assessment report so that we can get our baseline for the trust, hopefully doing that in pieces, as was proposed by the Klein Consulting Group, so that we can start working on at least one of the topics and then space that out so that within 6 months to a year, we have a full comprehensive plan, but we can do it in chunks instead of having to have the whole thing done before we can start moving, so that we can get a really good, robust RFP out in the fall for some programming. Then we want to host the receptions, the meet and greets, and the listening sessions, and Avian has already started working on some different locations to get that going, and that will be parallel to and part of the needs assessment process to hear what the community thinks, because everything that has been done within the last year or two, everything was just turned on its ear because of the pandemic. So we want to make sure that we're getting real-time data and input from the community as to what they need and what they see the gaps as. Because another thing that I've also discovered is that not only did we have all of these needs that came about as a result of the pandemic, but a lot of funding came into the community as a result. So if there are agencies that are already doing some of the work that we've identified as a high need, but they're getting $20 or $30 million already from the federal government through CARES Act or URSA money, then I think we should factor that in. So these are the kinds of things that I want to be able to present to you all so that you can make fully informed decisions about where we should invest our dollars, because relative to what the feds have, it's not quite as much. And then, of course, oversee the first RFP process. I really, really, really want to get some of the money flowing to the community, because I know that's on everyone's mind. So that is my report.
Thank you. Does anyone have any questions?
What's the vision behind the meet and greet? I got the listening sessions, but I don't have the meet and greet.
The meet and greet was initially the event that was scheduled but canceled because of COVID, when the applicants for the executive director position, so we were going to take that and do a meet and greet for the community, just to have sort of an open house to meet the team, to perhaps meet the board, just to give feedback. So that may happen, that would be more of an evening or after hours type event, whereas the listening sessions, I think, is probably important to do during the day, during work hours, so that we can get more of the provider community involved and engaged. So, does that sound okay? I'm certainly open to ideas and input too.
Yeah, great. I just wanted to make sure I got it.
Okay.
Tim, so this is
Picture of it.
this is my area of specialty, so I'm all for it. But it's one thing, so my company hosted the one for Tallahassee. So if I can talk to her, or we can get together, I can
Yes.
tell you what they did there, because my office coordinator in Tallahassee, who I also cover that area, did everything for one of the meet and greets for the Leon County person. And for the water safety, I absolutely love that. My company, again, we actually offer free swim lessons because of how important this is in the state of Florida. So, and the Children's Medical Services and Sunshine Health are actually launching a campaign with the Department of Health to talk about, the campaign is called maybe Water Safely, but so there's a campaign coming out around all of this. So it's very, very important, and I'm sure it's because of the legislative stuff. So we can connect and see how I can help share the information that we have to see what we can do.
Thank you. That would be wonderful.
Tammy, I'm sorry, if you can, how much are we putting on the ground? How much are we awarding? What's the?
I don't even have a ballpark idea on that because it really depends on the capacity of the providers. I intentionally didn't want to put a cap because I really don't know how much it would take to pull this off quickly. I'm guessing 100,000, but I didn't want to put a cap, and I also didn't want to put a minimum because sometimes people don't even need that much, depending on what their infrastructure is.
So totally, how much will we be able to award from this first round?
Well, we've got available for grants right now in our budget. We've got over $8 million earmarked just for grants, and that's after we pay the county fee and all of the salaries and all the overhead. We still have 8 million. Oh, and that's minus the contingency. So we have 8 million that we
Right.
can give.
And will it be just limited to kindergarten readiness, or what will be the scope?
Just for this first round. It's just for a summer bridge program, just a short, intensive, get them ready to get into kindergarten, get them ready for the first day of kindergarten type program.
Awesome.
So it's a very short, easy
Just for the summer day camp
RFP.
programs in community centers and things like that.
Right, exactly.
And I guess that's what your grant committee, review committee would help figure out, like, okay, we don't need to spend you might want to spend $8 million on it, but we want to
Exactly.
spend a couple $1 million this summer, we want to save the rest of it for the next year.
Exactly.
I don't know, I'm just
Yeah.
assuming, okay.
Yeah, and then the grant committee, of course, would bring the recommendations back to the full board and say, okay, we had this many and this many of them ranked, a good score, whatever the committee decides will be the cutoff, and then those total up to this amount, and we recommend that for funding. So I got a process.
So quickly, if we can get back to the water safety
Oh, I'm sorry.
campaign. I'm sorry. May is Water Safety Prevention Month. And the ounce.org, that's a Florida organization, it's a nonprofit. They have available toolkits and messaging, and all that is free, along with the Department of Children and Families. We promote that yearly with pamphlets and brochures, but I think we need to get some awareness campaigns out there more than just these brochures and pamphlets. But it is Water Safety Month, and I have tons of stuff I can share.
Wonderful. Wonderful. Well, the more we can just connect people to and make available, even if it's something as simple as printing the information that's already there and co-branding it, which I'm a big fan of, not reinventing the wheel and saving some money. Absolutely. So any resources that you have, if the board votes to pursue this, then absolutely, I would like to make sure that all of that information is incorporated.
Going to speak as the retired pediatric intensive care physician here for a second on the water safety. Every year, we have these children come in, and it is one of the greatest tragedies with the largest ripple effect that you can imagine. The people, the guilt on the parts of the family and the family members, divorce rates, other statistics show that this is just one of the areas of greatest impact, adverse, obviously, on families and communities and otherwise. And I would applaud us and encourage us as this organization to pick something. The only downside to what we're doing here is kind of alluding, yes, May is Water Safety Month. We see these situations, unfortunately, year-round. But it is something that I think would be a very strong message and a very appropriate message and all for us to get behind.
Thank you.
Tammy, thank you, and certainly, I know you being in South Florida, Miami has aggressively put together programs for black and brown children in
Yes.
disadvantaged neighborhoods that I'm fully aware of because of drownings that have happened that have been so unfortunate. So not only in the actual campaign, but if there's opportunities for us to expand this into providing dollars for access for poor children, I certainly appreciate it. I mean, because those who are affluent have the opportunity to be around water. Those who are poor that live in the urban core and the inner city don't. And it's certainly a shame, as I've said multiple times, that poor black and brown children who live in the Panhandle can't swim because there's a lack of access to water. So the educational process is great for me, but the implementation and the practical implementation is much more important because they are not aware of the water. I mean, so many of our kids at CAYs, Lincoln Park, Oakcrest have never been to the beach. They've never been exposed to any pool of water. So if we can obviously do education, but education's no good without teaching. And so, I mean, I would be very supportive if we could expand that to not only the educational process, but actually the programmatic side of implementing it.
Lumen, that's kind of where my company comes in, because if they qualify for Medicaid, they actually do get free swim lessons.
Wow.
Yeah, and a lot of our
awesome.
members don't utilize that, but if they qualify for Medicaid and have Sunshine Health, we actually give vouchers for free swim lessons every year.
And if we can connect
that's-
that, rather
yeah.
than us spend our money, if we can connect that as a
Exactly.
group,
Yeah.
that's very important.
Yes, sir.
Yeah, and that's really an excellent point, and I'm glad you said that, because what I had kind of in a sneaky way planned to do was then after we do the campaign, I did want to try to explore the possibility of doing some swim programs where we could teach children to swim, because you're absolutely right. Many communities just do not have access to the pools. They don't have access to swim lessons. Carolyn helped, she called several places because we were just trying to find out, okay, so where will the school district tell people to call? Is there information available? Are there swim lessons available? And they're expensive. Even some places will give reduced rate swim lessons, but they're $35. And if you can't afford food right now with inflation and your pay, swim lessons are going to be way down on the priority list, and that is really unfortunate. So whether it's vouchers or maybe funding a program to just provide free swim lessons to the children who qualify, I definitely want to look at that as a next step, because you're absolutely right. Telling somebody you need to learn to swim is great, but if they don't have the opportunity to learn to swim, the education does you no good.
Yeah, and Tori, and certainly I'm sure your organization provides a lot, and I did From Mullet to Sharks programs in many years, and that's why I'm familiar with Greater Miami, because I went down after multiple drownings that happened in our community, starting at Bruce's Beach. But the reality of it is, a campaign is great. Providing Medicare to pay the scholarship is awesome. But if I lack the transportation to get to the pool, that's, I mean, and so I don't know if y'all pay for that.
And we actually do have transportation services, so there's a tie-in, and that's why I love this program, because a lot of my job is I educate our members on their benefits. That's what I do for my job that pays my bills. And so our biggest issue is educating our members on that's a service that we offer, and making sure they have access to that service, and finding, so say if you want to get the swim lessons and you don't have access to a place that can get you there is a person that actually will call you and help you locate somebody that is within your area that you can get to and help with transportation. We have people that do that as well. So that's why I love this, because we do our best to get that information out, and a lot of our members don't know about it. But, I mean, my son took swim lessons last year, or 2 years ago, and, I mean, he's 10 now, so he was maybe 7 or 8. And around that age, they think they can swim, and their kids his friends' parents have pools, and we go to the pool all the time, and we go to the beach, and I was really in fear that he would think he could swim and jump out there and drown. And so he got swim lessons, and they are expensive. Mm-hmm. But the fact that my company will pay for our members that qualify for Medicaid and make sure they get to those lessons, and make sure that one of our employees will help them find somewhere and get them there, is just making sure that they know that information. So that's why I love tying that into making sure that they can get that service.
No, I'm all in. Let's go to Oakwood Terrace and Pensacola Village and
go.
take bus loads of children.
So
Let's
actually-
teach them to swim.
and
That's
actually,
why I'm saying teach them to swim.
I've been working with Woodland Heights, because I'm going to do a program with them this year, because we're doing it all summer. So I'm all for it.
All right, and we got to put some money in for a little girl's hair too, because that chlorine eats it up.
They actually have special shower caps for that now.
Oh, yeah. I get it. My daughter swims.
Yeah, I just want to thank you, Commissioner, for reminding us that lack of access does lead to lack of education. And that lack of education particularly does lead oftentimes to drowning. Don't forget, my brother was one of those.
Oh, no.
Yeah.
I'm so sorry. Thank you, Tammy.
Thank you.
We appreciate that.
Thank you.
Great report. So now we're going to move to our action items. The first is a revision for the executive director to serve on the Early Learning Coalition Board. There is the policy amendment is in the packet. So by statute, the pursuant to section 1002.834E, the executive director, someone from the board needs to sit on the ELC board, Early Learning Coalition Board, and it can either be the chair or it could be the executive director of the trust. And Tammy and I discussed, and we decided it'd be best if she sat on the board of the ELC instead of the chair, because the chair rotates every year, and there would be consistency if it's the executive director. However, we need to amend the policy to allow the executive director to sit on the board, because right now it says that no member of the ECT staff will serve as a board member. So we have to vote on that. So is there a motion to amend this policy? Is there a second?
Second.
Any discussion?
I have a
Yes.
question.
Yes.
Go ahead.
I also sit on the early learning board. So you guys probably. know
Well,
that.
that's
So
why we need Tammy to be it instead of myself, because we couldn't do it if it was myself, so.
Is
Patty?
that a voting position?
Yay, I get to see you more.
I have no idea.
Is that a voting position or is it an ex officio position? Because the school board member sits on it too. I'm not the one right now, but we don't get to vote, so I just wondered.
I think it's a voting position.
Any more discussion on that? All right, all in favor of amending the policy to allow the the executive director to sit on the ECT board?
Aye.
Any opposed? Okay. Next, we took off the days off, and that was because we were trying to figure out if we needed to add days off to be able to have more applicants, but we realized that we don't need to give anyone else any more days off, so we took that off. The next is the needs assessment. So that we have the proposal out that we sent out a few months ago to someone, the Klein House Consulting Group, to do the needs assessment proposal. They came back with $30,000. After discussion with the Personnel Committee, the new program director position, that person may be able to conduct our needs assessment for us, so we would not need to do the Klein House Consulting Group. So we talked about tabling this proposal and this action item until the next month, until we know if the program director is able to do our needs assessment in-house for us. So is there a motion to table the needs assessment proposal? Well, I need you to make a motion. Or,
I move to postpone it.
okay. Is there a second?
Second.
Any discussion on that?
A question for the group of doing this and trying to keep the 10,000-foot view of everything. Our impairment and challenges thus far in getting a director and looking at the proposal from Klein House that was a monthly report that took place over 6 months of getting them cumulative, and it wasn't until the very end that they gave us their kind of summary, et cetera, and we're then using this to help determine RFPs and priorities, et cetera. Are we going to be delaying this whole process by put off until we see this, and that doesn't happen, and so now we're going back to Klein House and we're not going to get their results for 6 more months that we've now postponed, and that we end up being yet further out? I'm just concerned with that, and if everyone is okay with that and feels that we're not going to be losing ground, again, the idea of trying to get some RFPs out and start funding some worthwhile projects, and with that being, at least in my mind, based in part on this needs assessment, that we don't have the whole process keep going and going and going.
That's a great point. The people that Tammy has, that Ms. Greer has interviewed would be able to do the needs assessment for us. So that's not a concern at this point? Is there any-
I voiced that same concern at our needs assessment committee meeting, and I was assured that, you know, we'll be able to move forward with the RFP today, and we should be able to get everything ready before the next tax levy comes in, so.
Okay, do we vote on that?
No.
No. All in favor of tabling or tabling the needs assessment proposal, say aye.
Aye.
Any opposed? Okay. The next is the RFP for the kindergarten bridge project. We have all been given the request for proposal to review. Mrs. Greer has discussed this with us, and her process that she's gotten several people who are experts on summer programs to review this and give input. So at this point, we just need to have a motion to, if we are going to do this RFP for the kindergarten bridge program.
So moved.
Is there a second?
Second.
Any discussion?
I wanted to ask, what will be the process for determining the awarding of the grants?
We would have a grants committee that would be selected, that would include members of the board who want to be part of the grants committee, as well as members of the community who did not apply for funding, but who are content experts, so perhaps a Title I kindergarten coordinator, or kindergarten teachers, or professors of early childhood education from the university. So subject matter experts. And then we have the criteria already in the RFP against which you would rank their answers. And so it's kind of like grading a test. And then the ones who rank highest, you just decide if you want the cutoff based on the scope of the responses that you got. What is the minimum grade, basically, that you're willing to approve? And then there would be a roster of the recommended proposals that would come out of the grants committee. And however much those total up to be, that's how much you would award. And so then and then that comes back to the full board, and if the board accepts the recommendations of the grant committee, then we would go into contracting. And so then we would work with each individual agency or provider that has submitted a proposal, and we would work with them to draft an agreement. At that point, that we get Meredith very heavily involved. and then we have a contract that has the full scope of work and the terms of the contract. And the understanding would be that they would have to have submitted all of their requests for reimbursements by September 30th, so that it all comes out of this fiscal year's funding. Did I answer your question?
Yes, I just
Okay.
wanted the public to be able to know what
Okay,
the
thank
process
you.
would be.
Thank you.
And I love that you have included an RFP information session for anyone interested. It's May 18th, if we approve this. It's May 18th from 9 to 11:30 as a location to be determined. So that's
And-
wonderful.
A question on that. Because one of the things we've talked about as a board is that there are a lot of providers out there, and we don't have a handle on who they all are. The Early Learning Coalition would have a number of people who would be involved in the early learning, the pre-K stuff. But have you had some thoughts about how you're going to, are you just going to put it on their website, or are there other thoughts about how you're going to get the information out?
We're going to connect with the Early Learning Coalition, of course, and with the KCAN group, the Kindergarten Community Action Network, through Achieve Escambia. We're going to put it on our website. We're going to send out our newsletters. We will ask that if there is a way that the school district, I was going to ask Dr. Smith, who I could connect with at the school district, to see if they could help get information out to any of the folks that, any of the providers that they know. Something that we have to be careful about is we can't send individual proposal or RFPs to a specific agency. We just have to send it out to various networks, because then it could be playing favorites. And so is that correct?
Yeah.
Is that, so I just want to make sure that we put it out through every possible public channel that we can, and encourage anybody and everybody to link the RFP or include the RFP in their newsletters.
The main reason I brought that up is because this would be our first time to do something. And I would, I want to be able to be as transparent and helpful to people knowing that it's available. And I was just trying to figure out, how do we do that? Because we can't say, okay, we'll just send it here and here and here and here. So thank you. I knew you'd have an idea, but I didn't want anybody to sit there thinking, oh, well, they didn't send a notice to me. So.
Any more discussion?
I have a question for clarification, I suspect, and I'm probably misreading this. On your RFP, it looks like a 5.3 Stage 1 technical review. In bolded print, we have submissions that do not include the requirements of the RFP will not move forward to Stage 2A review team application evaluation. I guess I'm reading that simplistically and saying, okay, all I have to do is take your requirements and cut and paste the list of the requirements. Is that what you mean, or do you mean submissions that do not meet the requirements or address the requirements, or simply that regurgitate back the requirements that we're including in the RFP?
At the very end, it shows the requirements for the submission of the RFP, and it says that you have to have, I believe it lists the narrative, the signature page, the acknowledgement of the addenda, and the budget, I believe, are
Yes,
the
budget.
key pieces. Those are the requirements. And so the narrative is defined, the requirements for the narrative are defined in a separate section that has the questions that you're supposed to address. So in other words, if someone turns in an application and they don't include the narrative, or they don't include a budget, then it hasn't met the technical review. They have to have all of the pieces.
Okay.
But those are things that you will discuss, correct, at the meeting on May 18th for people who are interested in applying?
Yes, absolutely. And then we will also we're going to record that session, and then it'll be available for anybody who can't make that meeting. We're going to try to do it on Zoom so people can attend remotely if that's easier, because we know that this is very last minute. And then we're also going to have a list of questions and answers. So if people have questions about the RFP, they can email them, and the email address is in there. And the reason we have them email them is so that we have them in writing, and then we can post their question exactly as it is posed, and then put a response in writing and have all of that on the website, so everybody has equal access to all of the same information.
Okay. I guess I'm just again trying to think and put things in perspective of recording and reflecting back on things I've heard in regards to health literacy, the average educational rate of literacy being somewhere around the 3rd to 6th grade within our service area. And unfortunately, that's not simply those we're wanting to serve. It's some of the providers, particularly when you're talking about the pre-K area. And as I'm reading that, going to submissions that do not include the requirements, and I see somebody simply going to the end of this RFP, the part where you say requirements, and literally cutting and pasting that and going, okay, I included them. I don't know why they wanted their own requirements back again, but I've included them. What we're really wanting them to do is address all the requirements or fulfill them. I'm just thinking that the include all the requirements is going, why? They don't know their own requirements? Why am I including their requirements back to them? I know what you're wanting to say, but what I'm thinking is the people that we're asking to respond and wanting to fill this out, again, we need to tone down our level of education in the way that we would read this, and think of way that the public that we're wanting to respond to these things are going to look at this and potentially see that and say, okay, if they want me to, I'll include last week's News Journal article or whatever as well, as opposed to really wanting to address what we're listing as requirements or putting in their requirements to be, I don't know, I'm just worried about the way that's worded there.
And that was section 5.3, you said?
Yes, and it's in bold print, is the other reason I'm even more worried about it, because it's really saying, you better include our requirements, okay?
Okay, thank you. I'll wordsmith that a little bit and make sure that that's easier to understand.
Any more discussion? All right, all in favor of the RFP for kindergarten readiness, say aye.
Aye.
Any opposed? All right, so that passes. All right, our last action item is the development of an invitation to bid for the public education campaigns for the importance of pre-K, early learning, and for water safety. And this is, as Ms. Greer said, this was just for her to know if we are interested, if the board interested in her developing this. It's not a, for sure we're going to do it, it's just an interest.
So move.
Is there a second?
Second.
All right, any discussion?
Nope.
No,
Okay, all in favor?
we're ready to buy it.
All right, any opposed? All right, so you have permission to develop this. All right, and now there's time for public comment. Is there anyone that submitted anything for public comment? Well, they've all left, well, except for our faithful three. Ms. Carolyn, Ms. Audrey, Ms. Wanda. We appreciate you being here. All right, at this time, we will adjourn. Our next meeting is June the 14th, back here, and we look forward to seeing you all then. Thank you so much.